In that case, it's time to move on to our next speaker, who obviously is now going to have a second career at the Edinburgh Fringe in the double act of Hammond and Pomeroy. So James Pomeroy is Group HSSES Director for Lloyd's Register. James has been involved in leading and transforming HSES programs in a whole variety of sectors and countries for over 30 years. He's a fellow of the Institute of Occupational Safety and Health and the Institute of Environmental Management and Assessment. And you've heard of 3 degrees of freedom. Well, James has 4 in engineering, business management, environmental law, and OHS. Now, we always enjoy James's contributions at these conferences we do because of his ability to make sense of the complex and explain it with clarity. So, James, I'll hand the floor over to you for the next while.
Okay, thank you very much, Dougie. And I shall make a note to myself for future to never follow Dr. Phil Hammond and never be set up. So I don't have any answers for you. What I have is a load of questions, and questions really about actually what the pandemic actually means for the profession of safety. So what I'll do is I'll share with you some of the insights and reflections that I've taken from Lloyd's Register's approach, but they're also from having the privilege to speak to about 30 to 40 safety leaders, directors who've actually been involved, and some of you will recognise some of this feedback because you've contributed to it. So what I'm trying to do is to actually think about what are some of the themes that Phil talked about there. He talked about social value. He talked about care and compassion. He talked about things like capacity. Now, all of those are really interesting. So what I'd like to do is to actually present to you what I think are some themes that come out of this pandemic, and what some of the things that Phil talked about actually could look like for occupational health and safety. But before I do, I think context is always helpful. So I will provide a bit of context to Lloyd's Register's experience of the pandemic in terms of what it meant for us. And hopefully you'll resonate with some of these and you can think about some of the changes. So we've been busily focusing on COVID for roughly about 20 months now. We were early into the situation. We had about 20 surveyors in Wuhan, and then we had about 250 personnel in China. So very, very early on in terms of the lockdown, but it taught us a lot. The first thing it taught us was all our planning was useless, absolutely useless, because quite frankly, we hadn't really thought through the scenarios. We hadn't envisaged some of these things, but I'll come back to that as the theme earlier. The second area that we really taught us was we needed to respond in real time. So you'll see down the bottom there our crisis management plan. We had done some great work before. The team had prepared us, thinking about how to create capacity in our systems. And we were learning in real time. What that means in practice is actually looking at what's going on in China, creating playbooks and lessons, and then sharing that through to Europe and through to the Americas. That was critical for us. So the concept of how do we learn in real time, what's actually happening, was critical. We're also fortunate that remote surveys, for us, we have about 1,000 what we would term essential key workers. And to contextualize what Lloyd's Register does, well, it sends out surveyors, assessors to inspect ships, vessels, energy and critical infrastructure. If they don't sign off on that critical infrastructure, the vessel doesn't sail. The implications of that is we don't get foodstuffs, we don't get fuel, we don't get the essential commodities and medicines that we actually need to fight the pandemic. So we are providing a critical service to actually support the fight for the pandemic. So the ability to move from doing physical surveys, sending surveyors onto vessels and other infrastructure, to doing that remotely and enabling that to be done safely in a regulated, approved way was really critical. And some elements of our business are up to 80% remote now. That's how much it's transformed us. Travel, we were an organisation that travelled extensively before the pandemic, and like you, I should think our business travel is a fraction, and it probably will never recover. because like you, we're used to these conferences today. We benefit a lot from social interaction, but we're realizing that actually there's other ways of working. So it's fundamentally changed how we do business as well. We had quite a few surveyors early on in the first 2 months or so who were impacted. We had in the order of about 60 personnel who were in the wrong place of the world, but we also had surveyors who were on board vessels. You may recall these stories of vessels being in Japan, in China, everywhere around the world where nobody wanted these cruise ships. Well, that's the type of work that our personnel do. So how do we deal with the emotional issues and the challenges of being on board a vessel and the staff being away from their homes? We had people who were completely thrown in the other areas of the world and couldn't get home. In some cases, for up to 3 to 4 months it's taken, and we still have some people in the wrong place of the world nearly 2 years later. We had to really think quickly. So I said earlier that we had plans and procedures before. So what we had to do was we had to make those measures go global and learn in real time. And some of the things that Phil talked about, I'll come to talk about in a moment. So thinking about how we learn in real time. So some of the practical things that we did. We were forward purchasing protective equipment globally, realizing that we were about to get something huge in March, and we were forward purchasing so our essential personnel could do their job. We did blackout tests. We sent everybody home and tested the network's ability. So we were testing the capacity, and we were doing that well before governments were talking about lockdowns. And we were doing this on the basis of what was coming out of China. But we kept that process going. So we introduced lateral flow testing, in many areas of the world, well ahead of where governments were doing it. So again, it's an example of saying, well, the only thing we've really got is testing to be able to provide a degree of assurance. So even now in countries where the governments aren't doing it, we're still doing lateral flow testing and other forms of testing, such as PCR in some areas as well. And then that's really continued throughout. So one of the earliest things that we learned from China, and particularly from Wuhan, was the mental duress and stress that it had on our 25 colleagues in Wuhan. And we were having daily kind of contact calls with them to actually keep in touch with them to make sure they were good. And we were using things like WeChat. So the things that we've now become accustomed to, we had to learn. We didn't have a playbook for it. We had to learn very, very quickly. And that has created many tools and approaches that have taken us forward. So those are some of the kind of lessons. And I think the final kind of things that I would highlight in terms of some of the lessons that we've taken. So we developed a vaccine policy, and we did that roughly around January time, realizing that vaccine mandates, as we were rolling vaccines out across the world, we needed to think ahead. We're already starting to see that clients would start to mandate vaccines and actually ask for only vaccinated surveyors. Interestingly, however, that hasn't transpired. We have the policy, we have the process, support for colleagues and so on, but colleagues are still asking, clients rather, are still asking about testing rather than vaccines. And the final piece to share with you is about global well-being and mental health support. So we're still doing that. We're doing lots of kind of dialing calls, providing tools for managers. We could certainly do a lot more in this area. We certainly have not got that fixed. And I think for us, that's probably one of the biggest lessons. As is often said, we kind of talk a lot about safety. We don't talk enough about health and well-being. And if there's one silver lining to come out of this, it's the fact that we've now got greater recognition of that. So that's a bit about our experience. What I do is I'll take you now through to some of the kind of lessons and themes that I think we've learned over the past 18, 20 months. And as I said a moment ago, they're themes that resonate with other colleagues, and we'll open up for conversations and discussion in a moment and try and get some of your thoughts about whether you reflect some of these. So let's deal with the first one in terms of some of the lessons. So agility was something that really came through very, very early on for us. We had to think in real time. We had to actually develop plans and procedures. Like many businesses, we had put planning and procedures in for things like pandemics, but we learned very early on they were useless. They were useless because they hadn't actually thought through government lockdowns. They hadn't thought through travel restrictions, and they were from a certain lens. So what we had to do was we had to think about, how do we develop agility in our business? What does agility mean? It means, how do we flip from doing 100% on-site surveys to actually doing a large proportion of them, surveys, assessments, doing them remotely? And how do we think about getting approval from our regulatory bodies to do that? So agility was really fundamental for us. Now it's a lesson for us, and everyone says, yes, agility is important. But if we think about actually how safety works, safety is really about rigidity. It's really about predicting, planning, proceduralizing, and then auditing to say, yeah, they're following the process that we defined a month, a year or so ago. That PDCA model does not incorporate agility. And I think one of the big challenges that comes from us, comes out of the pandemic, is about, how do we move to more agile systems while still keeping a degree of control? So my first lesson that I would put to you, that I think safety needs to change as a result of the pandemic, is moving towards a more dynamic model where we have more adaptation and more agility in our processes. And we're going back to Darwinian principles. It's not the fittest that survive, it's the ability to adapt. The individuals and the organizations who've really thrived and survived through this are the ones that have adapted their business model and been able to show adaptation. And I think that's really key for us to consider in safety, because it's not something that fits well within many of the processes we have for safety. So let's have a look at another one. Trust. Right, trust is super interesting. So Phil was talking about this earlier on. He's talking about the ability to actually empower people, and we all thrive better when we have a degree of freedom. Now, this is really in some ways opposite to safety. If you think about the lexicon of safety, think about the words that we use, trust doesn't appear. Words like predict, plan, proceduralize, audit, these actually are really key within safety, but trust isn't. And so trust is fundamental to how some of the lessons we take forward from this. And we're finding colleagues now are talking much, much more about trust. They're saying, you trusted me to work wherever, you trusted me to work from home, you trusted me to get on with my work and to deliver it whenever and however. So how can I be trusted in my new workplace? So I think that that is something that we really need to think about. And it's in opposite to how we currently think about safety and control, which is about, how do we control risks rather than necessarily having a degree of flexibility in there. So my second lesson that I think is really key for us is about trust. I don't have the answer for that, but we certainly have to move away from some of the rigidity that we have in our systems and some of the high controls that we have to provide a degree of trust to employees. So let's look at a third one now, which is about value. So value is super interesting. So Phil was talking a moment ago, he's talking about what the value is for employees and talking about concepts like social value. Now, one thing I've noticed over the past 18 months is organizations really talk about their social value a lot more. They talk about frontline workers and key workers, and organizations to actually sit and reflect about, what is their social value? What is their social purpose beyond serving shareholders and maximizing shareholder value? Actually, what do they give back to society? So we're seeing a lot of organizations, from retailers to transportation to logistics, talking about how they serve a higher purpose. I think that's really interesting. And that's interesting from a safety context, because it makes us think differently about the nature of our value in our organizations. If you're thinking, what's this guy going on about? We often think about value in organizations as being in hierarchies. So the senior leaders are most important in terms of value. But when the government actually determines that your frontline workers are key and are essential and categorizes them and labels them, and we come out on a Thursday evening and we clap for them, that gives you a sense of where the social value of an organisation may be and how it is important that we focus on them and their needs. So I think the concept of value versus status is very interesting, and it takes us into who makes decisions, how much real consultation there is that happens in organisations, and how we think about some of those areas. Okay, so let's talk about the fourth area. Now, Phil talked about this a moment ago, and he talked about masks and talked about masks when we wear masks. It's about actually caring for others, and it's a visible sign of showing you care. Now, that's interesting because what we've found in the pandemic is we've done a lot of things that are evidential, and we had to think on our feet, and we've had to develop a scientific evidence-based approach. But a lot of what we've done is not evidential. So I walk into buildings and there's temperature monitoring on the buildings, or I walk into areas early on when the science around masks wasn't clear. So there are some things that we're doing that we know are not truly evidential, that we're doing them for an emotional reason. And what does that tell us about a time when we think we need to be more evidential? We're introducing concepts like the safety case into other sectors now, which is an evidential form of safety. How do we think about building emotional support and trust for colleagues as opposed to purely evidential? An evidential approach is a risk assessment, is a numeric basis, is a target. But an emotional response is probably more about storytelling, empathy, listening, and realizing that pure facts alone are not going to be enough to support colleagues. So I think when we think about one of the lessons coming from the pandemic, evidence is really interesting. And let's just take a couple of examples to remind ourselves of things we're doing that are not necessarily evidential. So deep cleaning of offices, there's no evidence for that, but we do it for reassurance. Or we could take temperature monitoring. There's not many scientific papers that actually show that it works, and it certainly doesn't work for people who are asymptomatic. But many, many organizations are doing it. Even in some countries in Asia, it's mandated because it's done, because it's known it's a visible sign of reassurance. So before I move to the fifth area, let's just take a recap. Agility, the idea about being flexible and not having so many systems that are locked down, having the ability to adapt in real time. Trust, how do we trust employees, giving them more freedom to the work whenever to get on with their work, and perhaps less focus on targets, metrics, so that it's measured on outcomes and work is what you do, not necessarily where you are. How do we develop more trust in our systems, particularly a challenge for safety, which is driven around control? And thirdly, thinking about value. Value is critical, I think, for us to think about who is making decisions about risk and safety, who's the expert, and how do we learn from them? I haven't been able to get out in our frontline staff for the past 20 months. So the real experts in safety have been our frontline staff telling us. That tells us something about the value and knowledge and where that's coming from. And fourthly, emotion and evidence, thinking about how do we balance out the need to be evidential, to be scientific, as Phil was saying, and to keep up with scientific developments, but at the same time, actually recognizing that we need to do things that are not solely based on evidence. It's not necessarily something we feel comfortable with, and it's something you can go into social media and see a whole load of commentary about whether these things are necessarily purposeful and thought through. In some respects, it doesn't matter. If employees want them for evidential, for comfort, then we may need to do some of them. So those are the four. I'll come back to them as we do a summary in a moment. Let's look at the fifth now. So let's talk about communication. So Phil talked quite a bit about the government's communication strategy, and also talked about some of the things that the Prime Minister done and some of the unfortunate things that the UK Health Secretary did at the time. So some of the things we can think about when we think about communication, this has been a lesson in how to think about safety communications. the things that have worked well and the things that haven't worked well. So let's take some examples. In the government, in the UK government, some of the best messages were simple and concise. Things like hands, face, and space. That's a really simple message that contains 4 really important things that we can all think about and we can all do. It's actionable, it's clear, it's very concise, and it's something which is personal to all of us. And it's very, very prescriptive. Let me provide you another example of the second version of the government's, which is be safe, be aware. Stay alert was the message. Now, I don't know what stay alert means. And after about 4 weeks, stay alert was dropped because it's vague. It doesn't mean anything. I don't know what to do. It's not something that's actionable. But that's relevant for safety and health because hands, face, space, you can get that. You can think about something which is actionable, clear, and concise versus stay alert. Some of the best communication that I've seen for organizations from a safety front has been personal, has been very, very clear in terms of what it's asking people to do, has come from employees themselves, messages that they've been involved in creating, and it's been consistent. It hasn't been changed every 2 or 3 weeks. It's actually something they've run with for about 6 months. So from a safety communication, I think we can look back and think, what has actually worked? I think about the communications that we had at Lloyd's Register. We came up with about 8 to 9 very simple golden rules about things that we want to do along the lines of hands, face, and space. And really, probably about 4 of them, I would, in hindsight, go back and actually use, and I would have dropped at least half of them. Why? Because they're not concise, they're not memorable. They don't follow this magic 7 that we talk about, or 7 things that we can consciously remember. So I think communication is really important for safety, and we need to think back to the last year and a half and actually think what's worked. So in summary, something which is actionable versus aspirational, a zero harm, home safe message. It's good to have if that's your thing, but it's not very clear what it means, and neither is a stay alert message. So the 6 areas about principles versus rules. Now, I've spent best part of 30 years in safety. My first 10 years was very much doing a traditional model around safety, rules, prescription, and then auditing. In the latter 15 to 20 years, it's been very much using principles and frameworks. Now, I've really learned the lesson of that over the past year and a half, 2 years, because the idea of using principles and frameworks has really come into its own. So a principle determines the outcome, but doesn't necessarily state the method. It provides a degree of flexibility, and it's important because in Lloyd's Register, we have people in pretty much every country around the world doing a different thing each and every day. So we need principles versus prescriptive rules that tell people, but we also have to adapt to an emerging situation. So when we stick to high level principles, we provide that degree of discretion. And I think one of the challenges that we face as a safety profession now is how do we move away from things that are too onerous, too prescriptive? Can we address some of the challenges around agility and trust by moving some of our systems to more frameworks and principles that provide a degree of discretion and enable us to adapt in real time? So I think that's really key. So for me, I think the 6th lesson is about thinking about the balance between prescription and more high level principles and frameworks. It doesn't work in all circumstances, and I'm not saying it's a universal panacea, but it's certainly something that I think from how we think about safety, we traditionally think about rules and prescription. And I think that we may want to think about that again and perhaps adapt a bit more agility with it. Okay, so the 4th area Phil talked a lot about. Capacity has been fundamental to healthcare, to governments, but also to organizations. So if we think about our capacity and what saw us through and what helped our employees, it was the capacity to actually work remotely. We're all doing this conference remotely. So I think capacity has been fundamental. We can equally think about the limits of capacity. So protective equipment early on in May and June for many organisations was a problem. So understanding the boundaries of the system, the ability to have laptops and to provide home working was a capacity constraint for many organisations. But there's also issues that have come to the fore for many regulated businesses. I was speaking to at least 3 operators the other day in the marine and oil and gas sector, and they were saying essential workers was fundamental for them, identifying who was key within their organizations, who had key training and authorization, and that capacity can come in a number of ways. So one of the lessons that we learned was about the capacity for authorization of financial controls, not just safety related controls, but that has consequences if we want to buy equipment or we want to help employees. So capacity in terms of not just a physical, but environmental, but capacity in terms of organizational knowledge. Who is authorized, who is competent? And one of the things that we're going through is actually reviewing back. We did this with our group board about a month or so ago and did a deep dive and look back at what worked. And one of the key things for us was understanding the boundaries of capacity and the dependencies between our organizations. So who does what and who is authorized and what type of limitations there are. And as is so often the case, it's often the small things. We didn't necessarily think that it would be the provision of protective equipment that would be the Achilles heel, but it was. But we got the big things right, like the IT and laptops, but other things, and equally having the right people who were technically authorized was a capacity constraint. So cross-training is one of the big lessons coming out of this for us. So that to me I think is the 7th area. And we'll have plenty of time to discuss some of these and welcome your thoughts. Okay, so the 8th is dear to my heart, and it's about listening. It's about the idea of actually understanding. So I haven't been able to actually leave either my home office or the office in our offices in London for the best part of 2 years because travel's been restricted. But I've had to learn and had to adapt. We've had to develop procedures, and we've had to, through our gold, silver, and bronze teams, actually keep evolving our response. Now, the only way of doing that is by listening and engaging. And that causes us to reflect who the real safety experts are and where the real knowledge in the organization is. And I stand in front of you as someone who's been doing safety for 30 years and say, I'm not a safety expert. The safety experts in our organization are the individuals doing the work. So how do we have genuine consultation? How do we really listen to them? And how do we get feedback where they actually feel comfortable to create that safe space that Phil alluded to, that we can say, this didn't go right, or actually, this doesn't work for me. We've done a number of surveys locally, trying to get the pulse of the organization, trying to understand what's working and what's not, but also getting storytelling to work so people can tell us actually what works and what doesn't work. So I think just to recap before I come to open it up, because I want to give plenty of time for discussion. The key things that I think in the second areas that I would that I've talked through, how do we develop things that are actionable in terms of our communication? How do we think the lessons that we've taken from our communication? What do we learn from it? What worked in terms of our communication and what didn't work? 6th lesson I would share with you is how do we think about our principles and frameworks versus very fixed rules? And hopefully that's something that resonates with you, because I think that moving towards more principles and frameworks is key. The 7th is always an area of learning for us all, which is, do we understand the boundaries of our systems that we're operating in? Do we understand the dependencies, who we are dependent within our organization, who has the right skills and knowledge or equipment, or where there may be dependencies outside? I, for one, didn't realize we had such a criticality in the UK on CO2 production, for example, and suddenly I realized that's a criticality that I wasn't aware of before. You've probably got your own dependencies and knowledges. So how do we think about how we learn? Because very often the safety issues that we're facing are not traditional safety issues. They're emerging from the system and the boundaries, the complexities of the system. And the final piece is about listening. So how do we actually develop a method of truly listening where we use curiosity and open questions to actually learn from employees in real time, where they have the comfort to actually talk to us and actually tell us what's working and what needs to change in our organizations and systems, that we can become listening organizations, that we truly listen to what they have to say and actually truly develop a method of learning from it. I think that for me is key. So those are the lessons that I'd like to share with you. I'm conscious there's a lot there, and I'm hoping you've got lots of thoughts and questions. So what I'd like to do now is give us much more time to think about some of these questions and think about some of the areas that they may mean. So I'm going to open it up for thoughts. And Dougie, I don't know whether you're able to moderate on some of these questions because I can't see them coming through.
Yeah, thanks, James. As ever, you've separated out the wood from the trees for us. Yes, so I've got visibility here. So if anyone want to ask James anything about what he's observing here, or wants to give their own angle on it, then please fire ahead. You can grab the microphone.
Don't be shy now. Everyone's got lessons from this, and I think we can all learn from each other.
Well, I'll put my hand up again. It's Tony Gray again from the Northeast, just to make the day go quicker. Just a question, I guess an observation, and not to preempt anything about the independent inquiry for COVID, but I guess it was fair to say that not just the NHS or the UK, but the world was unprepared for this. All of the emergency planning that we'd ever done in the NHS, going back to bird flu in 2009, all of it was kind of chucked out the window in the first couple of weeks of COVID.
I think that's really interesting, Tony. One of the things that struck me is about the benefit we take from audit and the comfort that we take from that. And what I'm getting at here was that two of the countries that were in the top 3 as being assessed by the World Health Organization in 2018, I believe it was the UK and the US. So we were independently assessed by the WHO, and they said that these countries were best prepared. Now that, whatever flows from that inquiry, I don't know, but that actually begs a question about what we take from audit and perhaps the false assurance that we take from audit. I don't know, but I think there's certainly questions to be asked there. One thing I would say, Tony, is that I've certainly come to think a lot more about planning and the benefit of planning versus the plan itself. What am I getting at there? We have a bit of an obsession in safety about this stuff, paper. We love to say we can demonstrate we've got a plan. I think the ability to do planning is fundamentally, key, but it may be that doesn't necessarily lead to procedures and process. It leads to organizational, muscle memory, as we say. And so I think this concept of planning versus plan, and where I was talking about earlier, the comfort that we take from audit could be a problem for us. I don't know. That would be my thoughts. I don't know whether you have any thoughts on that.
Yeah, just to come back, I guess part of it is having been involved in emergency planning for an NHS organisation across the region and nationally. I guess one of my observations is planning costs money as well. Yeah. And I guess part of it is we've suddenly realised how much money it costs to deal with a real life event. I guess the other issue is nobody would have predicted, because most of the historic NHS plans are for a one-off event. A bad winter, that type of stuff, a big flu, those type of things, not for some type of enduring event that would last eons effectively. And now the fact that we're coming to live with it.
Yeah, I'll just come back if I may, and then we'll go back to some other questions. So if we think about something that Phil said, Phil was talking about comparing the airline industry to healthcare. So some of you work in the airline industry. One of the things that the airline industry does incredibly well is scenario planning, and particularly around pilots, where they put them in simulators. Now, the capacity of new technology would enable that. The cost of it's going to, really drop, and it's going to become much easier. And I'm seeing people using simple VR headsets now to do scenario planning. And there's so much literature coming through now to say that concept of planning and just putting incidents, accidents, unforeseen events. So whether it's doing desktops with your senior leadership team or planning individuals to be able to deal with it, that's really what I'm getting at with creating ability to deal with capacity in different scenarios versus, as we had, an 82-page pandemic plan that went out the window very, very quickly.
Agree with that, yeah.
Yeah. Thank you. Burju, you've got your hand up. Far ahead.
Yeah, so working in the rail and construction, I found it really interesting what you said about creating trust versus the principles and rules. So to be open, if you like, one of my biggest concerns is you give the guys enough rope and freedom, etc. However, I know for a fact, I've been in the game long enough that they will take liberties. And it's like, as soon as they see us relaxing the leash, if you like, then it's like, great, where's that corner? Because I'm going to cut it, so to speak. Yeah. And then obviously you got your incidents and so on and so forth and the usual aftermath. So it's a definite juxtaposition. I understand it and it sounds fantastic, but in reality, I'd love it to happen because it makes my life a hell of a lot easier.
Yeah.
From a selfish perspective, but in reality, I just can't see that working.
I think you've got some really interesting challenges. I as I said early on, I don't have any answers for this, but it is a trend. We're already seeing that people in some sectors are leaving organizations within this kind of great resignation that we talk about, because some of the trust that they had actually is being withdrawn and they're being required to resort to kind of 2019 practices. Now, in high risk sectors, of course, we're going to need rigidity and control in some areas. But, if we look at some of the new thinking around safety, which is about how do we have capacity and agility and how do we really deal with everyday events. So, yeah, I think you're absolutely right. It's not a panacea. It's going to present problems. But I think it is a challenge that we face, which is how do we give more trust and how do we do that within a framework of adaptation? Where are the boundaries, I guess, because we certainly know that having long, rigid procedures is really questionable.
Yeah, cool. Cheers.
Okay, all right, good. Anyone else want to pick up on anything that James has said, and in particular, perhaps even share with us some of your own approaches that your organisations have taken during the past 18 months? One of the things that you'd said, James, there was a couple of items on your list which I kind of wondered whether they were not so much at odds with each other, but could potentially be at clash with one another. I think you said, things about communications being actionable, which absolutely, I totally agree with that. The more that you can make it about individuals and make it personal and make it things that you can go ahead and do, then the better. But the one below it, then, principles, what you're saying is that, well, let's work more with general principles and general frameworks. Does that too potentially start to clash, in that you've got one there that's very specific and one that's saying, well, actually, let's not work out detailed procedures and rules, let's just be general. So for example, during the COVID thing, we had a general rule here in Scotland, which was that you had to stay near home. Well, that's a principle. As far as I'm concerned, that's open to interpretation. So I just wondered whether there was a potential for
clash. I mean, these are eight that I see, and they're picked up from individuals that I've spoken to. I think, as we've said already, that they won't work for everybody, but they are areas that we need to really think about. And some of them do clash. The idea of actually listening to employees and really doing real-time engagement, they may come up with things that we don't agree with. We just need to have frameworks that enable that to respond. And yes, you're right, the concept of actually having principles and rules versus clear, actionable communication. I guess what I'm trying to get at with this is that safety has moved, Dougie, over the past 2 or 3 years into kind of visionary statements. And I don't wish to open this up to a whole debate about zero harm, because that would probably take the whole conference. But actually what do some of these statements mean? They're hearts and minds kind of statements, and they are somewhat ambiguous. They're visionary, but they are in some ways employees struggle with them, because actually what do they actually mean to do? And equally, some of the communication that we issue quite a bit is quite prescriptive. So are we able to actually to digest what do we want to say to individuals, and how do we say it? And I think the final point on this is thinking about the audience a little more. I think there's not a lot of communication training that happens with safety professionals, and yet we know that communication is probably one of the biggest tools that we have. I don't know of any formal training courses where you can actually go as a safety professional and learn how to communicate messages visually, understand how people interpret messages, and that I think is a real competency area for us. Because if we think about how we write or how we present or how we use these visionary statements, do we often think about how they're received? So I think one of the key points for me is understanding the audience and thinking about how they're received, both in terms of who is the audience, what do we want them to do, how do we want them to respond to that, and what behavioural change do we actually want?
Good. Thanks, James. Richard, you have your hand up. Please, you can take the microphone, take the floor.
Yeah, hi, thanks. Thanks for that, James. Really interesting points. Recognise a lot of those. I'm particularly interested in the value piece. So I work in the water sector, have done pretty much all my life. And I've always found that the people that tend to work and stick in the water sector already recognise the social value of what we do in terms of the provision of potable water to people, but also, and perhaps more so in many ways, the protecting the environment aspect of our work. And often that's been the core driver that people have. And in situations whereby getting the water back onto people or potentially stopping the pollution, the core driver is protecting the environment or serving the customers, and that overrides safety thinking at times.
Yeah.
And introduces risk, and that becomes the core driver. I think, reflecting on what you've said, I think we have a real opportunity in our sector to think about the social value and how that influences the individual safety thinking rather than perhaps overriding that. And I just wondered how successful you'd been or how you'd found linking the social value to personal safety with what you've done over the last 18 months.
It certainly calls us to reflect a lot more. We talk a lot more about the importance of our frontline staff. I don't think 2 years ago, Richard, we would have described them. They are, but we wouldn't have ever described them as key workers or essential workers.
Yeah.
Now, I think that's, I'll put a hand up. That's my failing. I should have recognised earlier on that the real value is in frontline staff, and it's now really into the communication where we thank them, we praise them, and recognise. I love the fact you talk about goal conflicts, because I think that's really key. We have exactly the same challenge, which is we serve a purpose of keeping a vessel sailing, and that may cause them to do some things. In fact, some of the most serious incidents that I've looked at and our teams have had to investigate is where they've come up against the types of conflicts that you talk about. A vessel has to sail or water has to be put onto residents' homes, and that causes people to make decisions. And I think when we talk about understanding the system in which people operate, it means that when we start to talk about rules and golden rules and lifesavers, we understand that there are other things, other complications going on here. And so balancing out serving that higher purpose and key workers alongside saying, no, there are real things that you absolutely can't do. Sometimes we get it right. I think more often we do, but there are times when we perhaps don't.
Yeah, and I think that links directly to the principles aspect, as opposed to trying to understand every scenario, document that, control that. It's focusing on key principles and trusting people then therefore to make the right decisions based on all the various conflicts that they're facing at the time.
Yeah, I think it's about scenario modelling. I mean, the way often safety works is we say, here's a procedure, here's the way to do it, rather than actually presenting a scenario and saying, well, here's what the procedure says. where couldn't you do this? What are the challenges that you face? And really creating an environment where people are happy to talk about the conflicts that they face. I think that to me is a big lesson I take out of this, which is about active listening and thinking about where the procedures and rules sit within the challenges that they face in real time.
Yeah, well, that's a really good point. Thank you.
I think just on the wider piece of this kind of essential workers, if people are kind of struggling to think about what it actually means, let's just kind of think about if you're in logistics or you're kind of responsible for providing, getting materials to clients. I don't think 2 years ago we would have actually given a lot of thought to the welfare of lorry drivers and truck drivers, and even actually thought about them as necessarily being key workers. But now, the idea that truck drivers spend 5 days away from home quite often, the fact that their well-being is not looked after as a society because we've taken much of the parking away from them. We start to think about actually they are a dependency. And we can think about gig workers. The whole conversation about gig workers 2 or 3 years ago was about minimum wage. The fact that we all managed to survive through the hard work and commitment of people actually doing deliveries, home deliveries, I think makes us rethink about it. It's not just the healthcare. There are other people involved in that critical infrastructure that we are dependent upon. So I think for me, that's one of the takeouts as well.
Yeah, agreed. Thank you.
Thanks, Richard. Just time for anyone last input, if anyone wants to.
Well, if not, if there isn't, Dougie, I'll give you one final thought we haven't talked about.
Sorry, Chris. Chris Hawk. Yeah, Chris, go ahead.
Hello there. Sorry, slightly unfamiliar IT. So can you hear me okay, Dougie?
Yeah, we can hear you fine, Chris.
Yes, I was just wondering. So I was also thinking about the rules to principles sort of thing, which other questions have also been asking about as well. That's interesting and challenging. I presume most of your assessors are highly skilled, highly competent people, though. This may be a factor and something to think about as well.
Yeah, competence is an issue. Yeah.
Yeah, I presume and different sectors, like I'm from waste and recycling sector, where you've got much more of a range of people from highly skilled to much less skilled. So I think you've got to cater for a broader list, set of people there. Do you have any more examples, though, I suppose is my question, of where the rules to principles, addition to the scenario that you talked about just then, any more examples where that's fruitful? Because that's interesting and challenging.
Yeah, I think standardization is another area. So if you've got a role that is very standardized, then having set rules on how you respond from a quality safety perspective are clear. Where you've got a lot of adaptation and you've introduced the issue around competency and the level of kind of knowledge you've got. But it's interesting because actually I'm sure there's some on the call who would say some of the some instances they've had where people have felt they're overconfident. But I think understanding the degree of standardization versus local adaptation that's required gives us a thought about, do we have very clear rules that define it? And equally, do we have a degree of adaptation? And the challenge on adaptation is, how do we define those boundaries? Back to the discussion we had a moment ago about how do we make people know that there are some things in the challenges and goal trade-offs that they have where they understand there are limits.
Okay, thanks. Something to think about. Yep. I'll let you get to your point now. Sorry about that.
Right. So I think just one, no problem. So one final thing I would just leave you with is I didn't talk at all over those 8 points, which is about what we've learned in terms of data and digital. So I think for many employees over the last 2 years has been the first time they've had to use a safety related app, which is a COVID app. And then it's also one of the times that we've got some real-time data in terms of case rates and information, infection rates within our own staff. So there's something in terms of what we're talking about in this conference on a data and digital side, which is another source of data. And also, how do we harness the technology, the idea of safety apps, to take us through to build on that as another silver lining come out of it. So on that note, I'll hand back to you, Dougie.
Thank you, James. Yeah, as ever, as I say, you managed to see the wood from the trees, and that's really great. Okay.